So without further ado, I want to welcome you to our workshop on navigating the local response to cannabis legalization. This is an incredibly timely topic because as more communities across the country face the complex challenges of legalization, we as a PTTC want to be responsive. So today we'll focus on strategies for addressing the impact of this evolving landscape, and we'll explore some policy changes effect for youth and identify some tools for effective prevention and discuss some local solutions. I encourage you all to think critically about the unique needs of your community as we engage in this important dialogue. And again, I thank you for joining us. Let's go ahead and dive into this conversation. These are our acknowledgments. What's important to understand is that the opinions that you may hear expressed are those of the PTTC network and do not reflect the official position of the Department of Health and Human Services or SAMHSA. Therefore, no support or endorsement of DHHS or SAMHSA for the opinions described in this document is intended or should be inferred. And that's our grant number at the bottom. So in case you want to do any research on where we get our money from, there, full disclosure is out there for you as well. Our learning objectives for today. We're going to describe the impact of cannabis legalization on youth, and then we're going to define some actionable steps to effectively address the impact of cannabis legalization. And I know it's affecting all of your communities differently, and you'll get an opportunity to share some of that back with us as well. Now, the moment that I've all been waiting for. Introductions. It is my pleasure to introduce Mariah Flynn. She's a certified prevention specialist with over 23 years of experience in the substance misuse field in Vermont. Mariah currently serves as director of the Burlington Partnership for Healthy Communities, leading prevention efforts in the region. She's also a founding member of Prevention Works Vermont, and she works tirelessly on statewide and regional prevention initiatives. With a passion for building healthier communities, Mariah has developed a toolkit for cannabis policy improvement, and it's dedicated to supporting youth and families in making healthy choices. So please join me in welcoming Mariah Flynn. If you could please put it in the chat. Also, just share where you're from and which sector of prevention that you're working in. Well, which sector of the spectrum that you're working in. So just introduce yourself in chat and tell us just a little bit about you, whether it be your title or the organization you work for, so we get an idea of what the type of work that you're doing. We got Aaron, Audrey, Catherine, Kim. Well, these people must be in a group together. Okay, Lee Manley out of DC, Sharon out of Texas. Okay, that's our region. We cover Texas, Louisiana, New Mexico, Arkansas, and Oklahoma. So glad to have you here from our region. And welcome to everyone else from all the other regions as well. We're glad that you choose us as a PTTC to seek your continuing education. Okay, without further ado, I put you in the hands of, well, let me talk about our roadmap for today also. We're going to start out by letting you know about cannabis and marijuana, and then we're going to talk about some of the laws and how they've changed. And then we're going to talk with you about youth and cannabis as well, and then some policy strategies that support health and youth prevention. And of course, provide you some resources and end with our evaluation. At this time, I'm going to do a poll with you. I'm going to put our first poll up. And in that question, I just want to ask you to ask yourself the question, I have a clear understanding of the state's laws related to marijuana or cannabis and what is currently legal. I have a clear understanding state's laws related to cannabis and what is currently legal.
Thank you. It looks like we're getting some good responses in there. Hi, everyone. I'm Mariah. Thank you so much for inviting me here today, Derek. We've got about 82% of people who've participated, so we'll give you like just another couple of seconds to get in your response, and then maybe we can end the poll so we can share the results with everybody.
Perfect.
See where everyone is.
It's like
Great.
you have
So, yeah, go
a
ahead.
highly informed group here.
Yeah, I love this. We've got a range of where people feel like they are in terms of what they understand about their state. A good number of you feel like you have a good, clear understanding of your state's laws, which is great. You'll have a good starting spot for today. Let's stop sharing this one and we'll jump to the second poll.
Second poll is, I understand the health risks related to cannabis or marijuana use, and I'm confident about talking to others about them. I understand the health risks related to marijuana or cannabis use, and I'm confident about talking to others about them.
And this just helps us to understand where we should focus our energy and our conversation today for the folks that are in the room, and how much time we spend on each part of the presentation. We can adapt a little bit as we go. It's also helpful to see as you're answering. We've got a lot of prevention specialists here, which is great today. I saw there were some folks that were coming from the school system and some youth centers. So I like that. I love that we have quite a variety of different areas of prevention you're coming from, and probably different perspectives on what you're seeing in your communities too. So I hope there'll be a chance for you to share some of that with everyone. I think we'll probably, I have some stuff to share with you. It's just a compilation of things that I put together that have been helpful in my community, and I adjusted some for your region. But usually the wealth of the knowledge is in the people who attend these things. So please do share your perspectives in the chat about what you're seeing too that might be useful for others to know. Do you want to share? I think we've got a good participation with this again. If you want to share the results again with the group.
It's like about 70% either strongly agree or agree that they understand the risks.
Awesome. And so wonderful. So we're going to go through some of that piece of it fairly quickly today. So it's great to know that you guys have a pretty good understanding. And for those who don't, who feel like they need some more talking points, we also have those included. So, so we'll try to meet everyone's needs today, hopefully. I think we can stop sharing and we'll jump into the next bit. So I am going to start by just kind of setting the stage for everyone so that we all do have the same frame of reference for what we're talking about today. So again, thank you so much to the PTCC for inviting me to be here with you all. As Derek said, I've been working in the substance use prevention field for more than 23 years. And what I noticed in the last decade in particular, I've seen a rapidly changing shift in the conversation and the policies around cannabis. You probably all are experiencing something similar. There's new laws, new language, tons of new research. There's a growing list of cannabis products, there's new delivery methods, and there's increasing potency of cannabis. So I'm finding it hard to keep up with all of that and stay informed. And if you're confused about the changing terminology and laws, you're not alone. And know that if you're confused about it, likely your communities are as well. So I think that's why it's really important for our field to catch up, make sure that we have a clear frame of reference so that we can help others make informed decisions around cannabis. So in the next section of slides, we're going to break it down and try to go through some of the key things that are helpful for us to be on the same page about so that we can be informing our communities around them. Please do ask questions as we go along. Derek's going to try to help me kind of keep track of those, I think, as we go. We might not have a chance to get to all of them today because there's a lot of you and a lot of questions about this topic, but we'll do our best. And hopefully we'll have a chance to open it up a little bit to the room as well in the as we move along. So first, I just wanted to make sure everyone understands when we talk about this. You might have seen in the way we asked the polling questions that we used marijuana/cannabis, depending on how you talk about this in your community. And what's happening is that people are using that language interchangeably, or sometimes depending on the state that you're living in, one is given preference for how people are talking about it. But there is historical and scientific distinctions between those words, so we should talk about that. The word cannabis is a generic term. It's usually used to refer to preparations derived from the cannabis sativa plant. And the word marijuana refers to parts of or materials of the plant, usually the leaves and flowers, that contain substantial amounts of THC or tetrahydrocannabinol, which is the psychoactive component that makes people intoxicated in the plant. So more recently, you'll see that that word marijuana is being replaced with cannabis with THC or cannabis because of a racially charged history connected to use of the word marijuana. So we're going to talk more about changing laws and the language around those changing laws. But for instance, why this is important, in my own state of Vermont, where I'm coming to you from today, we legalized commercial sales of cannabis. In our legislature, they mandated that the word marijuana be changed to cannabis in all the laws. So depending on, like I said, what state you're living in, it may be called different things. But for the purposes of what they mean in our Vermont law, it refers to anything that contains more than 0.3% THC. And products with less than that are labeled as hemp. So today I'm going to use the word cannabis unless there is a study or a data source that uses the word marijuana, because I don't want to change the meaning of their data. But when I'm saying cannabis, I'm talking about cannabis with THC for the most part today. So this slide shows you the relationship between cannabis, marijuana, hemp, and CBD. This is based on how the federal statute makes the distinction between the components and the language. So you can see that both hemp and marijuana or cannabis originate from the cannabis sativa plant. The plants also look and smell identical, so the only way to tell the difference is through testing. And the main difference is just the amount of THC they contain. So like I said, anything less than 0.3% is considered hemp, more than 0.3% is marijuana or cannabis with THC, as I said. It's also helpful to know what CBD is. So you might have seen that popping up in stores in the last decade. CBD stands for cannabidiol. It's the second most prevalent of the active components in cannabis. It can be derived from either the hemp plant or the cannabis with THC plant. And by itself, CBD does not cause a high like THC. And there's actually some evidence that suggests that CBD might help moderate some of the negative impacts from THC. Like I said, because it's supposed to be less than 0.3% THC, you might find it in stores where, in states where THC itself is not legal, or cannabis with THC is not legal. One thing I will say, though, that there's a number of studies now that have tested common CBD products and found THC or other ingredients that were not on the label in them. And I'm hearing a lot in my communities, maybe you are too, about parents giving CBD to their kids. So you might find it helpful to share information with parents to have them exercise some caution around these products. They're not well monitored, and there does seem to be sometimes that they contain highly potent with THC in them. Let's also talk about medical cannabis. We could have a whole workshop on medical cannabis, so we're not going to spend a ton of time around that today, because we're talking mostly about legalization and impact on communities. But it is important to know that the FDA has not approved the cannabis plant itself for treatment of any disease or condition. However, they have approved 1 cannabis-derived and 3 cannabis-related drugs that can be available with a prescription only. So these are the 3 prescriptions that contain cannabis-derived compounds. One which is a purified CBD from cannabis, and it's for 2 rare forms of epilepsy. And another 2 that are synthetic forms that are used to treat nausea and vomiting from chemotherapy or weight loss from HIV and AIDS. There's also another synthetically derived product that has a similar structure to THC called Sesamet. I hope I'm saying that correctly. It's not my area of expertise. Also used for chemotherapy. So these are the only approved prescriptions. And then there's, as you probably are aware, there's other cannabis that's being used for medical uses, but it does not come with a federally approved prescription. Usually in states that are allowing for medical cannabis, they have a medical cannabis card. The person's allowed a medical cannabis card.
Well, thank you, Mariah, for that wonderful introduction to cannabis and giving us like the foundation to start on. And now that we've talked about language around cannabis, let's talk a little bit about cannabis and how it's been changing in the last few years and what it looks like today, because there's so many significant changes that are taking place, especially as preventionists. We want to make sure that we know what to look out for and what to educate, of course, the parents and the teachers about and everyone else in the community so that we can help our students evade some of this danger.
I appreciate that. Thanks, Jarek. Yes, let's talk a little bit about what THC looks like. So this slide gives you a little bit of an example of what illegal cannabis products are looking like. So this graph shows samples of illegal cannabis products that were confiscated by the Drug Enforcement Agency, or DEA, as part of a potency monitoring program that NIDA does. You can see from the slide that there's been an increase in the amount of THC that's in these products. So the red line is the percentage of THC that's been in confiscated products. And remember, that's the component of cannabis that gets people high. And that blue line is the amount of CBD that was in the confiscated products. You can see there's been a slight decrease in the amount of CBD that's been in products over time. So that decreasing of CBD, which sometimes seems to mitigate negative effects of THC, or there's been some suggestion of that. There's been a decreasing in that impact and then an increasing of potency. So probably a higher potential for dependency over time. And so this is the illicit market. And we're seeing some similar things in the legal market. So as you saw in the last slide, potency in illicit products was increasing. Some reports are showing that the average potency in today's legal market is around 20% of THC, with the majority of products have over 15% THC. And in some of the legal cannabis with THC concentrates that are available for sale today in the US, they can get up to 95% or more THC. So as a result, we can assume that the cannabis available today carries a higher potential for addiction and other health risks. There's also been an escalation in the amount and the frequency that people who use regularly are using. So, for example, in the pre-2000s, the average regular user in Washington used about 4.6 milligrams of THC a day. And today, the average daily user in Washington uses about 260 milligrams or 1.3 grams of cannabis a day. If you're assuming that they're using that average potency of about 20%, that's about 60 times as much THC as they were using 20 years ago. So I like to think about that in comparison to something that you might see in your own everyday life. 1 cup of coffee has about 95 milligrams of caffeine. To get 60 times as much caffeine, you'd have to drink 38 16-ounce Starbucks cappuccinos in one day. So it's just a dramatic difference, right, in the last couple of decades than we had been seeing before. So things are changing. The other thing I just wanted to note too is that not all cannabis is created equal. So cannabis is now available to be used in many different forms. You can smoke it, you can eat it, inhale it, vape it, drink it, use it intravenously, to name a few options. And so this just shows a few forms that some of the cannabis with THC comes in today. You're probably familiar with the buds in that top left corner. But the reality is that what people are using today may not look or feel anything like what the general public is familiar with. So when you're having conversations about this with your communities, trying to educate youth or families or the general public, they might not even have the frame of reference for what you're talking about. Can you, I'd love to just hear in the chat, why you think it might be useful for either you and your work to understand or be able to recognize these forms, or why it's useful for the public to understand or recognize these forms. Does anyone have any thoughts about why our field needs to start to understand and recognize some of what's happening?
Oh, go ahead and get in the chat, everyone. Let's see what you have to say. We have Susan that says it's important because
for parents, a couple of folks are saying for parents to be able to recognize so they can talk about it with their kids, know if it's coming up, if they've seen something in their house. Knowledge is power. I love that, Tori. Clinicians in residential settings to know what you're seeing in the what clinicians are seeing. Yes, I saw someone noting that some of these more intensely potent forms that you're seeing on the screen are also more likely to have health consequences like cannabis-induced psychosis. I love that. Thank you all. There's a lot of being able to recognize products, folks are saying. I think it's really helpful when you're thinking about youth and families, and also when you're thinking about at the community level, what kind of information people know, to be able to think about how do we improve policy, how do we improve what we're doing in our systems, so and do people have the right language and the right understanding of what's available to be able to think about how to support prevention strategies. I also wanted to note that these images were all, not all, but most of these images and the ones you'll see on the next couple of slides were taken from a website that's called thcphotos.org. It was created by the group One Chance to Grow Up. It's a national group, and they're free photos that you can use for education in your presentations or your materials that you're using to educate the public. So I encourage you to check it out if you're looking. Sometimes that had been the hardest piece for me, trying to find photos so that I could show people what we were doing. So I encourage you to check it out if you're trying to do some of this type of education yourself. And there we go, slides. So this, I'm going to go through the next couple of slides quickly, I will put that that website. Sorry, Lily is asking again. The website is thcphotos.org. You can just put it in the chat. Yeah,
It's done right.
Melissa just popped it in there. I appreciate that. So I think they're trying to update it with all the legal products from all the states that have legalized. They're a little behind, but they're slowly getting them in there. So now we're looking at what are some of the legal commercial THC products that are for sale in states that have legalized. I know that a lot of the states in the region that you all are, that this PTCs represents, do not have legal commercial cannabis. So there'll be a few and then a few in here just to kind of show you what's happening in some of the other states as well. So here in Washington, you can see there's some examples of legal products that they have in Washington state, things like peach ring gummies, chocolate chip cookie dough, orange cream soda, a lot of food related things, gummies. And in Colorado, because that is one of our first states in the US that legalized commercial cannabis, they do have a lot of different variety in all the things that now have cannabis in them. So you can see there's an inhaler, there's sexual lubricants, things like mouth spray, lots of different products. One of the challenges maybe with THC is that it really does lend itself to being added to pretty much anything. Here's just a few more examples to show you a smattering of across the US, things I pulled from different states. And just like the illicit market, the legal market has a variety of products that can be ingested in many different ways. They have varying range levels of potency. And as you can see from the products, there are types of things that are often attractive to kids. I'll share actually, yesterday I got a text from about something that happened in our school district. Kids were getting off the bus. In our school, students take the city bus to get to school. And a bunch of elementary school students were getting off the bus and they found, according to the kids, they found a packet of gummies unopened that they ate, and it turns out that they were gummies with cannabis in them, and they all got sick, and the school had to respond. I'm going to be talking to the news later today about this issue. So I think you can see that a lot of these products are attractive to kids, and that's a thing for us to be thinking about as a field, and also to be thinking about what are the strategies that we help protect kids around these issues. So you can see here that there's things like, infused into tablets, cannabis infused into breath mist in Nevada, infused into soup in my own state of Vermont. We like to put maple in everything, so there's a lot of maple flavored cannabis products these days. And in New Mexico, in your area, I chose a selection of things that had really varying rates of THC, some of the highest things in the concentrates or in things like lotions. Oh, I think we
Well,
went.
I can just say from my own perspective at this point, as a preventionist, been working in the field for 20-something years, I am amazed at how far the cannabis industry has gone to target the youth. I mean, I know the general public is confused about cannabis, but they're getting so creative now, they're confusing preventionists as well. And all these things that have been changing so rapidly. So it's important that the prevention field understands also our federal and state laws to help provide some clarity for those who are underage and their families, and to advocate for policies and to protect public health. And now that you've covered the general context of cannabis use and its impact, it even showed us some of these products that there really looks to me like they're targeting you with. kind of shift gears and focus on what's currently legal and when it comes to cannabis, because understanding the legal landscape is crucial as it differs significantly from state to state, and it can directly influence prevention efforts and community outreach. So, Mariah, let's explore the variations in legalization from medical to recreational use, and then sort of like highlight the key of regulations that apply to our region, because this will help us identify the opportunities and challenges for local responses to cannabis legalization.
Thank you, Derek. Yeah, let's talk about, so this next slide that you'll see on your screen shows you, this was updated in February of this year. I don't think anything's changed since then. The Pew Research Center put together a list of the states that have legalized commercial cannabis sales, either for what they call recreational use or medical use. And you can see kind of the dark green are states that have legalized recreational, commercial use. And the lighter green is the states that have medical use only. And then the kind of light gray is neither one of those is legal. So I would just love to hear from folks that are on the call or the webinar today. What are you noticing about this map? Is there anything that's standing out to you? What you're kind of seeing as you look at the states as a whole?
Okay, I'm checking the chat. Recreational and medical use on the rise, and the coasts are very green.
Yeah, there is a clumping. I'm also noticing a clumping of things, of states that have legalized together.
The East Coast seems to be more liberal and high concentration of legal marijuana in the Northeast, where Chelsea is located. And then more states have legalized cannabis versus medical only.
Mm-hmm.
Just a few of the observations.
Thank you for sharing. Yeah, there's in many of those states that you see that have recreational and medical use, they started out as just that light green. They started out as just medical use, and then they have their legislatures have slowly been passing recreational or commercial sales. One of the things that stood out to me too is that same, I forget who noted that there's like a concentration of states that have legalized on each of the East Coast. And it seems to be that legalization in one state is impacting the surrounding states. So what happened in New England in the area where I live is that often the legislatures or the states were worried that they would lose out on revenue by residents going to a neighboring state to buy cannabis. And so it put pressure on those states to, the surrounding states, to move towards legalization because they didn't want to miss out on that revenue. So it's something that you can think about as the states around your state that might happen to. You can, one of the reasons I think we're kind of all here today is to learn about what might be coming in your area too. If you're not in a state that is legalized, there's kind of continual pressure. One other thing that stood out to me in this data too is that if you go to the Pew Research Center's website on this, it shows that 1 in every 5 dispensaries in the U.S. is located within 20 miles of a state border, and that 29% of those border dispensaries adjoining a neighboring state with less permissive cannabis laws. So for example, Indiana and Kansas and Texas all have really restrictive cannabis laws. However, they're bordered by states that have legalized the drug for recreational or medical purposes. And the data shows that if someone lives in one of those 3 states, they can find more than 100 dispensaries within 20 miles of that state border. So even though your state hasn't legalized, it's it's easier to access because all of the dispensaries, or many of the dispensaries, are located on the border of the state. So what's happening in one state is impacting what's happening in other states. I love that we won't have time to get to it all today, but I love that you're sharing in the chat some of the things happening in your area. I think it's really helpful for us all to see what's happening. So I won't be able to respond to everything, but I am kind of keeping an eye on it and seeing that you guys are noticing what changes are happening in your states, what the impacts are. So I also just wanted to note, and I'm sure you guys are aware of this, that there's a lot of variation too in how states are handling legalization of cannabis. So I just in the interest of time, we picked out just a couple to highlight that there's differences. So for instance, Colorado was the first state to legalize cannabis. They had fairly permissive laws. So there's a few restrictions that they put in place around the amount you could have per serving and the amount that you could purchase at a time. They had, I think, some potential policies that were trying to get passed. As far as I understand, they have not yet passed around like limiting the potency of the products. But they started out kind of with less restrictive laws. You can see that as time passed, some of the states that have legalized since then have started to learn a little bit from what the earlier states adopted and tried to put in some more prevention protections. So appreciate that. So California has added in more about not using in public spaces, limits on advertising. New Mexico has done the same, no public consumption, limits on advertising, allowing municipalities to have some control in terms of zoning, and also limits on potency. So hopefully we can continue to learn from the data and the research in the years prior, but that's something to be paying attention to, is that we have learned some things about how to do this in a way that is less impactful to youth. I also want to acknowledge that possession, use, and sales of cannabis are still illegal federally. So we can't forget that. Marijuana is currently a Schedule I controlled substance under the Federal Controlled Substances Act. And just to, again, kind of give us all the same starting place, drugs and substances and certain chemicals are classified into 5 categories federally based on their potential medical value and potential for abuse. Schedule I is the most restrictive of those categories. They're reserved for drugs with no known medical use and high potential for dependence. Heroin and ecstasy and illegally manufactured fentanyl are examples of Schedule I drugs. But the White House and the Attorney General recently requested that the U.S. Department of Health and Human Services, HHS, that they conduct a scientific and medical review of how cannabis is scheduled under federal law, and they recommended that it be HHS recommended that it be reclassified to Schedule III, which is the category that is considered to have a moderate to low potential for physical and psychological dependence and has some accepted medical use in the US. And so examples of that are like ketamine, Tylenol with codeine, and they took public comment on that over the summer. Public comment closed in July of this year, and I think they're currently in the spot of reviewing the comments. Last I knew, they were not intending to do anything further with this until after the election. But that's where that process is now. So still currently illegal, but there's some changes happening around rescheduling the substance. Okay, and I just put this in here because today's focus is on the impact of the legal cannabis market, but it is important also to note that the illegal market is still going strong. So you can see from, I just picked out a smattering of news article headlines from across the country, kind of showing that here 2.2 million illegal cannabis packages that look like junk food were seized in California. There's a billion-dollar marijuana operation that was illegally run by the Chinese that was in a news report in my home state. PBS did a news story on the illegal market in New York. So there's just, in some states like California, it's even shown that like illegal sales might be increasing since they legalized cannabis. So it's important not to just focus on the legal market when you're thinking about where to prioritize your prevention efforts. The illicit or illegal market is still going strong in many areas, and also we need attention and strategies in that area also.
Very good point. I just want to ask one question for everyone. You can put it in the chat, but why, and this is, of course, to you as well, Mariah, but why does it matter that cannabis laws have been changing and cannabis has become more accessible? Why do you think, and you can answer in the chat, why does it matter that cannabis laws, to you especially, have been changing and cannabis has become more accessible?
I love that. Thank you,
As
Derek.
Mariah?
Yeah, thank you, Derek. And please do, I would love it if people throw their answers to that in the chat as well. I've been presenting thus far, trying to give you just a basis of information around this topic, right? But without too much judgment around it. But there are, as someone who works in substance use prevention, there are serious health impacts that we can't ignore as we're talking about, as all of this is happening to increase access to cannabis. And like we talked about before, there's a disconnect in the public in their understanding of the harms of cannabis. So I think it's really important that we understand what some of those are so that we can be having informed conversations with people about it.
Looking in the chat, and answers like, because it makes the perception that it's more acceptable, and it's no big deal, and focusing on THC since it's the problem. And what about DUIs and accidents in states that legalize marijuana? Where could I get those statistics? Because I think those statistics would help as well. But I mean, as we dive into this conversation, I think it's crucial to understand the health implications and the data surrounding cannabis use, because research continues to show both short-term and long-term effects on physical and mental health, which can vary based on factors like age and frequency of use. So in this next section, let's explore some of the most up-to-date data. I know you've done some great research on this and on the cannabis impact, and let's examine some of the trends and the statistics that highlight why understanding the health consequences is key. And I think those health consequences and knowing that data and knowing those statistics will significantly help preventionists as they try to shape effective prevention and policy efforts in their own community. So if you don't mind, let's go there, Mariah. I know you're prepared.
Thanks, Derek. That's great. And I love got Darla who's talking about one of the important reasons is that low perception of harm for youth, who's talking about their developmental brains. And I think that's a key point that hopefully our field continues to make over and over. Yes. Why this is so much more important for youth, and we'll talk about that a little bit more too. But so the next couple of slides just give you a breakdown. So you have one place where we know the research is clear around cannabis. One of the things that I think is a little bit of a benefit of the changing policy is that researchers have had a lot more interest in studying cannabis in the last decade or so. So when I started in this field, there were a lot of unanswered questions about cannabis. Like, I know the question used to come up for me 20 years ago, like, does do people who have mental illness, are they more likely to use cannabis, or does using cannabis cause mental illness, have mental illness impacts on mental health? And so some of those things have been answered in my time of working in this field. And I'm very grateful to that. And I think it helps us we're in a much better place now to be able to talk about these health impacts and have concrete data that we can use to support it. In my state, in our Department of Health did a research review in 2021 of all the research on cannabis that they could find. They compiled all the results and part of a health impact report on legalization. And they pulled out where there was substantial evidence that we can use and where there's moderate evidence. So I used that to kind of pull together what I thought were the most important pieces to note for today. So what they found was that there was substantial evidence in the research of a statistical association between cannabis use and worse respiratory symptoms, of having frequent chronic bronchitis episodes, that particularly was associated with long-term cannabis smoking, also of increased risk of motor vehicle crashes, lower birth rate of offspring if a mother is using, also development of schizophrenia or other psychoses, and that happens, the most highest risk of that is in more frequent use, and also that there's an association between using frequently and progressing to problem use or developing a substance use disorder. And that use at an early age is more connected to developing a substance use disorder. As I'm sure most of the folks on this call know today, the younger you start using, the more likely there is that someone will develop a substance use disorder. So all the data around cannabis backs that up and shows that there's substantial evidence of that. There's also moderate evidence of a number of other things. So in science, when something is deemed moderate, because I think sometimes we associate that with like less meaning, but when something's deemed moderate, it means that scientists are fairly confident that the evidence shows the real effects of that treatment or test from that research. So many policies and laws today are based on moderate evidence. For example, seatbelt laws are generally based on moderate evidence that wearing a seatbelt results in less severe injuries. So there's moderate evidence of a statistical association between cannabis use and overdose injuries. Also between respiratory distress, particularly among pediatric populations, and also particularly in states where cannabis is legal. So there's more likely to be, for pediatric patients to have increased risk of overdose injuries in states where cannabis has been legalized. There's also association with impaired learning, memory, and attention. That's usually in short-term use, but also over time. There's a small increased risk for developing a depressive disorder, and also if you developing a major depressive disorder is a risk factor for developing problem substance use. It's also associated with suicidal ideation and suicide attempts, in particular if you're using heavily with social anxiety disorder. And developing problem cannabis use is a risk for developing a substance use disorder with other substances as well. So, sorry for the whole bunch of health behavior talk all at once, but I wanted you to have it all in one couple of slides together, so you can have that for as you think about how to use that information in your communities.
Now that we've discussed what is legal regarding cannabis and the health data, which is so vital to the work that we do, it's essential to dive into why cannabis prevention is even more critical for youth. Adolescents of course, is a crucial time for brain development. And cannabis use at this stage can have lasting negative effects, as you have shared with us. But the risks are significantly higher for youth compared to adults as well. And making prevention efforts vital in that area. And it's always been emphasized in the area, but I mean, what you've shared with us is reinforcing that as well, giving us the question, why is it so important and so much more important for youth? So in the next section, let's explore why youth are particularly vulnerable and how addressing these risks early can prevent long-term consequences, because it's about the future at this point, and how can we safeguard our future and the well-being of our youth.
Thank you, Derek. Yes. And I can see actually, I can see from what people are sharing in the chat that that you are also concerned in particular about youth and how this is impacting them. I see Kim has noted that young people are telling her that they're using cannabis to deal with mental health, but it appears to be making it worse, which is consistent in what I've seen in the data as well, and actually consistent with what our there's a child psychiatrist in our area had been having a lot of conversations with about this, and kind of consistent with what mental health providers in our area were seeing, is that young people were using cannabis to address mental health issues, and it was having increased health impacts. And I think that's connected to what we know about youth, right? Which is that the earlier youth initiate use of any substance, including cannabis, the more likely they are to develop a substance use disorder. And that the more that we also know from the data and the research that the more that youth are exposed to substance use in their everyday lives, so the more they're seeing it in their communities, in their media, at home, the more they see it as normal and the less that they perceive it as harmful. And that can lead to a greater likelihood that they use it at younger ages. So how we think about how our communities are designed, what we're allowing in the media, what's legal and what's not, what's allowed at home, is very impactful on those, whether or not students or young people start using early. In the interest of time today, we're going to stick to just a little tiny bit of data, but I wanted to pull out this, the data from the 2023 National Youth Risk Behavior Survey that just came out recently. Just one little highlight from that. So the good news is that rates of youth substance use dropped during the pandemic. So you might have seen this in your own communities. Rates of alcohol, nicotine, and cannabis all dropped in 2021, and that stayed consistent in 2023 in the data. So what that made me think about a lot as we were doing work in our community is, how do we build on that success? There were a lot of things that were related to that, right? That we were going through a pandemic, and there were a lot of things impacting that, but that still is a success that we can figure out how we build on when we try to keep those rates lower. I wouldn't be surprised if we see the rates kind of increase again steadily over time, unless we take this opportunity and we make some changes. I do want to note that it's important to acknowledge that there are disparities that you'll see in this slide. We don't have time to break down all the reasons why there are disparities between different populations. But I did want to just acknowledge and highlight a few things. So you'll see that in 2023, 17% of high school students reported using cannabis, or actually I'll say marijuana in this slide because that is the question they asked. So they used the word marijuana in the survey that students took. So 17% of high school students reported using marijuana in the last 30 days. But you'll see that female students were more likely than male students to use marijuana, and LGBTQ plus students were more likely than their cisgender heterosexual students to currently use marijuana. So it's important to think, as we're thinking about what specific populations need, know that there are differences, and that to think about where to put your prevention efforts, and which populations need support, and strategies with wraparound support, and where you can have the biggest impact. I also want to say that it doesn't look from the data right now that that stabilization of youth use rates that we saw with the high school students and the middle school students, it doesn't look like that's carrying into adulthood, or that young adults are in that same place. So one area where you can also think about focusing prevention efforts is towards the young adult population. What we are seeing is that in past year, past month, and daily marijuana use have all reached the highest levels ever recorded for cannabis use. Cannabis use in the past year, past month, and daily for young adults has all reached the highest level ever recorded. So in the last round of data from 2021, we saw that past year marijuana use reached 43% for young adults. And just 5 years earlier in 2016, it was only at 34%. We also saw that daily marijuana use is significantly increasing. So back in 2020, or in 2021, 11% of young adults reported that they're using daily, whereas in 2016 it was 8%. So that is also increasing. And it appears that legalization, commercial legalization, is impacting those rates. So just in pulling out one data source, a study by researchers at Columbia University, School of Public Health, and Oregon State University, they found that in states where cannabis was legal, young adults who were not in college more often became frequent users of the drug than states that had not legalized. So there's lots of data sources. I've seen today that people are posting a lot of data that they're finding, and research that's coming out. As we've talked about, there's a lot of interest in doing research around this topic, which is so great. And I encourage you to think about what that data or what that research is saying around young adults and how you can put prevention efforts into place, or thinking about how things that you're doing supporting folks at younger ages, even in high school, can help carry over into their young adult years, because that seems to be a really high risk time. And I'm realizing that I'm way behind on your comments, so I'm just gonna move my screen. Here we go. Okay, I also just wanted to kind of give a little lay of the land of where we are in terms of legalization. So even though in general youth use rates, there we go, that's a little tongue twister for me, have not risen dramatically since states began legalizing cannabis. However, there is a relationship between legalization and youth use. So this is a comparison of states that have legalized cannabis. So you can see all the purple bars are from states that have legal recreational cannabis use, and the blue is a state who does not. Overlaid with the 2022 National Survey on Drug Use and Health data. And it shows that 9 out of the top 10 states that have the highest rates of annual marijuana use among youth have legalized the drug for recreational use. So Louisiana is the only one of those that hasn't. You can see that leading the list are New Mexico, Nevada, and Alaska, but it's fairly, it's within a few percentage points. So New Mexico's rates are at 19.24% for youth using cannabis. And then Nevada and Alaska are close to 15%. So the relationship between legalization and youth use is complex, and it's influenced by many different factors. But one of them is What's the availability of the substance? What's the perception of risk of cannabis use? And what are the social norms around cannabis use? So what happened in many of these states is likely that youth use rates were already high, and that's what tends to make a state more likely to legalize, is that if there's already a lower perception of risk of cannabis use, and that there are already social norms that kind of support cannabis use. So there's an association between those things. How are we doing on time? I think we're doing okay. So I do want to share that there are, we know that use of substances is harmful to the developing brain. We've talked about that. It's why prevention focuses on delaying use for as long as possible while that brain is still developing. All those things start developing to their fullest potential. However, there are a couple of reasons to give cannabis particular attention. And I just pulled out one of them just so we could think about that today, separate from other substances. So this just shows a long-term research study looking at the impact of cannabis use on success in college. And the graph is from a longitudinal study in Australia and New Zealand of student long-term running study showing that alcohol use had an effect on completing high school. So you can see in that first bar, the green is the students who reported that they were using marijuana weekly, and the kind of red yellow bar is students who reported they were using alcohol weekly. And you could see that alcohol seemed to have a higher impact on students completing high school, but not as much on enrolling in college or obtaining a university degree. Whereas marijuana or cannabis had a large effect on all three of those things. So there are some differences in this substance, just like any other substance, that seem to be happening with cannabis, and that are helpful to think about when we're thinking about where to put our prevention efforts also. Particularly career and academic success. So I've been talking quite a bit. I'm gonna invite Derek to lead us through having you all talk.
Thank you so much, Ryan. We've enjoyed every moment of it. We're going to get into some of your thoughts now as an audience members, because we all learn from each other. And you've all been so well in the chat and sharing your information, as well as sharing resources with each other. So I encourage you to go back through the chat if you haven't had a chance and look at some of the resources people shared. I want to ask a question at this time that we can think about as a group discussion, and that is, what changes have you seen related to cannabis use or promotion or availability in the communities that you work with? What changes have you seen related to cannabis use, promotion, or availability in the communities that you work in? And you can put it in the chat. If you don't have the chat capabilities, then here's one opportunity for you to unmute yourself, and you can talk if you prefer to say it that way. So what changes have you seen related to cannabis use, promotion, or availability in the communities that you work with?
Well, while folks are thinking about what they want to say, I do see that you all have been sharing some of those things already in the chat.
I see more 24/7, 24 hours, 7 days a week stores have come into play. Marijuana is accepted widely like alcohol. We see increased number of dispensaries. Yes, those have definitely impacted the environment, and increased in advertisement through, although it's illegal, there doesn't seem to be any accountability. And that's from Colleen. And there are
Mm-hmm.
now 3 cannabis retailers in our city, and that's from Chelsea, up from 1 retailer last year. So it's more than tripled the
Mm-hmm.
number of retailers in her community. They actually have cannabis events, Emily has told us about. Cannabis events called Doobie Dabblers. They are popping up everywhere, and some are very close to the schools. And there need to be ordinance in place. That's something where we can work in prevention to put policies in place so they can't be close to the schools. That's a policy area.
Mm-hmm.
Uh, People don't know the law and or think that they know the law and can do whatever they want. Oh my
Okay.
God, the chat is just full.
Yeah, I think that goes back to that piece that we're talking about is when laws change as quickly as they have been around cannabis, right? It's really like we've made drastic changes in the last 10 years, both the products that are available and the laws and how they're changing. It's really hard to keep up. We have a really large new American population in our area, and they were coming from countries where the laws were much different than here in the US, and they're also having a really hard time understanding like how everything's changing so quickly and what's legal and what's not. So I think it's really up to our field to get that information out there so that people know what is legal, what isn't, and what is healthy and what's not.
And the next question on this slide, of course, is how has this impacted the way you do your work? So what are you doing differently in your work since we are seeing all of these changes that are taking place within your community? What are you doing differently in your work? Each one can teach one. So here's an opportunity for you to share, maybe have an innovative idea that someone else could use within their community as well. But how's it impacting the way that you do your work?
Yeah,
Thank
particular.
you.
Is anyone having great success too? Is there something that you found that's really helping? I think we'd all love to hear that.
Yes. Environmental approaches. Thank you, Colleen. Working with the legislators and policymakers, educating them on the dangers. Chelsea says we're hoping to use positive community norms to emphasize most youth do not use cannabis. Good strategy.
Mm-hmm.
They're listing dangers with the teenagers. We have Facebook and website on the dangers of THC and marijuana, and we're targeting younger students with education on prevention. Or community outreach and events. Starting prevention with families. Good job. That home environment plays a big role in the choices that the youth make. Oh, combining cannabis and tobacco for more comprehensive policies in our city.
I love that, Carolina. That's a tricky one. It often in our field, right, different substances are siloed because of where the funding comes from for various work that you're doing, and trying to combine particularly cannabis and tobacco efforts, but now soon cannabis and alcohol efforts, because also a lot of the industry, it's the same industries. The industries for cannabis and alcohol are merging. Same with tobacco and cannabis. So the more that we can merge our strategies too, the more effective we'll be.
Really do think that it starts at home. In some cases, here in Arkansas where I live at, it's like the parents are getting access to the medical marijuana, but then they're sharing it with their youth if they feel that. And I don't think that that's covered by the same laws we have for alcohol, where we have no hosting laws, and they can get in trouble for it. But they're feeling like they can share with their youth as well. So another challenge.
Mm-hmm.
Okay. Well, I thank everyone for sharing. We're going to move on and let's talk to how we can talk to youth about cannabis.
That's
and just
great.
share
Thank
some of
you.
those.
Yeah, thank you all for sharing. Please do read each other's comments too and keep learning about, what you can learn from what other areas are doing. So this next little bit could be a whole workshop in itself, and I'd love to just have time to sit with you all and talk about this and how we can think about this together. Um, if I haven't repeated myself enough about this already today, I'm going to say it one more time. It is incredibly important for our field to be educating the public about the cannabis of today. There's a lot of misinformation out there, and the prevention field, I think, is best suited to combat that misinformation. I am the director of a coalition with lots of partnerships in the community. And one of the things that we do is we create easy talking points for other service providers like educators and doctors and clinicians in the community, to make it easier for them to talk with kids and families about cannabis. So I just pulled out a few examples of what those could look like, that are based on what the research in the field says about what points are resonating with teens. These will probably shift and change over time. This is some of what we found in the last 5 to 10, I'll say 5 years or so, from some of the research around what seems to be hitting well with the kids of today. But that will probably shift. So you'll need to update these as culture changes. But a few things that seem to resonate well for young people was kind of understanding and connecting with them around the idea that it's natural to feel curious about this topic, and that there are a lot of things changing, and that we're probably all need to work to better understand. So thinking about how you can understand or learn together with a young person, that the health impact seems to resonate as a really important talking point for teenagers. In particular, if you can have young people get information from doctors or healthcare providers, that seemed to be where students were most likely to hear that information and take it in and find it valuable. So thinking about how you can use providers or their doctor to share this information, but the health risks that we're talking with young people about, the health risks that are unique to youth, and about the developing brain. And helping students understand potency and why it matters so much more, why we're talking about the cannabis of today now, because of the potency that's high and the risk for health consequences is more significant. And also that I think somebody else was talking about that social norming of reinforcing that message that most teens are not using cannabis. Most teens are not using substances in general, and to just reinforce that over and over again and to normalize not using. And then if you think about how to talk about it, these were again a few points that seemed from the data seemed to resonate well with young people. So thinking about how to encourage critical thinking about the industry and the marketing that they're seeing, particularly in media that might be coming up in their social media or in other things that they're watching. This idea of sticking to the facts, not adding a lot of personal opinions, but sticking to what do we know in the facts. Helping them to role play or practice what it is they'll say in advance, to help them manage those situations where they might be offered a substance, and talking about what their goals are. That idea of motivational interviewing, right? Thinking about what their goals are and how substance use can get in the way of those goals that they want to accomplish for themselves. If you have other tips about what's worked for you when you're talking to kids about cannabis, please do share it in the chat. And I think maybe folks are always, yeah, I do love that. Stay away from scare tactics, always, always. It's not an effective strategy with young people. Sometimes I find it a little bit effective with parents, but not a strategy that's effective with young people at all. But yeah, if you have other, and I love that people are sharing some resources that they found that worked well with kids too. So if there are things that you're finding, resources that you like, talking points that have worked really well for in your work, please do share them in the chat so that folks can have that information. Somehow we're going to have to make sure that all the stuff in the chat gets to people too, so that you have some of this information. I do have a list of resources at the end.
Okay, we can make that happen. Also, just want to emphasize this time that, we now understand the importance of cannabis prevention for youth. We should. We've been focusing on it for a long time, and you've shared some of the newest insights with us about it. But let's turn our attention to how we can prevent and reduce misuse within our community as a whole, because prevention is not a one-size-fits-all approach. It requires tailored strategies, and we have to address the unique needs of each community. And we have people here from all over the United States today. So in the next section, let's just explore the evidence-based prevention methods, the community engagement strategies, and the role of education in reducing misuse. And you've covered a lot of this already, and I know we're getting ready to close now, but by focusing on these proactive measures, I know that we can create a supportive environment that promotes health and well-being for everyone. And that's what we overall want to do as prevention, is create that healthy environment, that supportive environment.
Thank you, Derek. That's great. Yes. So we are gonna, today's workshop is just about giving a little taste of each of the different pieces that it'd be helpful to know around this topic. This is not going to be, each section could be its own workshop. So we'll just give you an overview. So in thinking about the root causes of, well, let's talk a little bit about, we're focusing now on the community level. So there's a long history of science and research that have proven that substance use and misuse are both preventable and treatable. Evidence shows that where people live plays a key role in their health, and the factors that contribute to individuals developing a substance use disorder are complex, and there is no one strategy or program that will solve that issue. So we have to think about a socio-ecological model for prevention. To effectively prevent substance misuse, we have to engage in strategies at all levels. But we know that if we focus on population level change at those two outer level circles, trying to impact policies and systems and the community environment, that has the greatest impact for the community. So we want to think about addressing, when we're talking about cannabis use, we want to think about addressing these root causes when we're thinking about how to impact those systems and that community environment, looking at how is the community normalizing the use of cannabis? What is the access to and promotion of substances? Are there favorable attitudes around use? Is there a low perception of harm of cannabis? Is there a lack of regulation or enforcement of your current laws around cannabis? And are students using at an early age? So these are the places where you can look at, okay, what are the strategies that we can do that impact these things if we see that this is where, this is an area in your community where you're seeing that your community has some of these root causes. So to give you an example, when working at a community level, the simplest way to think about it is, how do we make the healthy substance use choices the easiest choices for all the people that live there? So one of the most effective ways to do that is to limit access and promotion of the substance use. And we've probably seen this over and over again with alcohol and tobacco, that kids who live in areas with a lot of advertising and stores that sell alcohol and tobacco are more likely to use alcohol and tobacco or to have favorable attitudes about using. And that's the same with cannabis, where I just posted here for you a few examples that we're seeing in the research, that the more exposure students have to cannabis-related advertising, the more dense or more retailers there are in one area, the more likely there are to be young people that are using in that area or having favorable attitudes about using. So this is just an example that you can use in your own work to share these examples with your community, and know that strategies that you can do that reduce advertising or reduce density of cannabis retailers are likely to have a really big impact on preventing youth substance use and exposure at a community level. And just so you know, any of these pictures with advertising are from my community and things that we're trying to get rid of, and some of the kids in our youth group who are seeing some of this advertising. So it's work that we're all doing across the US. So to think specifically about what those strategies might be, I wanted to give you kind of the list of community level strategies that we know have an impact on substance use. These are really taken from what we know has been effective with alcohol and tobacco, and there seems to be good, we have some data, I should say, that shows that they'll be effective also with cannabis. We're still learning about that because cannabis legalization is fairly new in terms of what we know in the research. But on this slide, you'll see the research-based prevention strategies. You can think about what we can do in terms of policy that's preemptively. So for states who have not legalized, you can think about how to put these things in place in case your state does go to legal cannabis sales. And you can also work on them retroactively for states that have. This is why it's important to understand what are the laws and regulations for your state, because whether or not you can do some of these things will depend on what is allowed in your state or in your municipality that you're working with. So some of these may or may not be allowed depending on how your state handles these things. But again, they're all kind of related to that same idea that we're trying to limit youth access and the promotion and the normalization of use in their everyday lives, right? So trying to have buffers between how where the sales are and the advertising is and where the places that they gather are, thinking about how many cannabis establishments you have in one given area, making sure that there's good warning around the health impacts, things like that. And one thing that we found in our community, and some of this was taken from some of the things I've put together for my community, some of it's taken from some great work that's happening in California around this, trying to put protections in place. But one thing we found is that if you're doing work at either a local or a state level around policy issues, regardless of the substance, you probably found that there are sectors of the population that are less than thrilled about increasing regulation and reducing access to substances. So as you work in their communities, I think it's helpful. These goals are things that most of the people in the sectors can get behind, even when their interests in them may vary. So if you can focus on protecting the youth, protecting the health of the community, and ensuring equity and reducing harm from the predatory industries, that's something that it's hard for many sectors to argue against. So it could sometimes be a unifying message or values to unify a conversation around. And it can help to focus some of that energy. So, like I said before, there are few people outside of our prevention field who are as well placed to help the public understand cannabis and what we should all know about it. So I wanted to give folks just a second to think about what's what's something that, just think about an issue that you're seeing in your community related to cannabis. A lot of you have noted them already in the chat. And think about what's one simple action step that you can take to improve that issue or that problem that you're seeing. It doesn't have to be a big thing. You can write it in the chat if you feel ready to do that, but if you want to take a minute and think about it, you can just kind of jot it down on a piece of paper next to you.
Okay.
I want to give folks a moment to think.
There were so many issues that came up in the chat. I know we're going to have some things come up now.
Mm-hmm.
Yes, this is a very important part, I think. Just one simple action step that you can take. We've given you several examples of things that have been done in other places, as well as your peers here have also provided you several different things that they've done as well within their community. So,
While you're thinking about yours, this image is from my own community. Some of the kids in our youth group a couple years were noticing that a lot of the vape-related products have been placed on the counter. You can see in here there's some cannabis tinctures, or I think these are CBD tinctures that are placed on the counter, but they have a cannabis leaf on them. And the vape products were also placed on the counter. So there was efforts to kind of help the community visualize what that looks like for a young person going to pay for something at the counter. And the kids took pictures of each other doing this. This was their work, and then shared it with their community.
okay.
I love that.
Partner with local sports teams for prevention. Provide lock boxes to our CBD Delta 8 stores for parents and customers. We got some good solutions by educate the community on cannabis issues through regional conferences. Okay.
That's great. Thank you. If you want to share your action step in the chat, please do. And I hope you at least, even if you're not ready to share it with the group, I hope you make at least one action step for yourself today, even if it's just to think about how can you share this presentation with others.
Oh, yes. And we will send this to you, of course, a link to this presentation. So you'll have these slides and you can actually do a presentation within your community. We only ask that you not change the slides.
Absolutely. So that just in quick summary, just to make sure that I made the points that I hoped to make today. The earlier the people start using any substance, the more likely they are to develop problem use, and that we know that those things like social norms and promotion of substances can increase underage use, and that we can do something about that. Communities can support limits on that exposure. You think about regulations around and limits around use in public spaces, and that can help impact that. And that we all need to work to educate ourselves so that we can educate others about the cannabis-related issues and increase that public understanding of the harms. Thank you so much for having me today, Derek and Wanda.
Well, we sincerely appreciate you giving your time to us and sharing it with everyone here today. We had over 200 people here in our presentation today from all around the country that are interested in this topic and helping to make changes within their community.
There are quite a few different groups that are across the nation that are working on cannabis-related policy issues, and and trying to get information out. I at this time, I'm not aware of any kind of national prevention campaign or like educational support nationally that's happening around this topic. I would love to see that happen in the future, but there are, as you mentioned, like states that are doing that work. There is a couple, I think a couple of folks noted a few different things in the chat. Yeah, I see someone has done a shout out to Smart Approaches to Marijuana, which is a group that's working on policy at the national level. There's also One Chance to Grow Up, which is another like substance use prevention effort at the national level. There is the Partnership for, oh, actually they changed their name. Is it still Partnership for Drug-Free America? Or, I'm gonna blank on that. Someone else will get it in there. But there's also Drug-Free America Foundation that's in there too, which is a different group. So there are a lot of groups that are working on this issue. There's Getting It Right from the Start, which is a California group that I like to look at for examples around policy work. They're doing a lot of really great work around that. And I think they're connected with the Prevention Institute. So yes, there's a lot of different work that's happening. I will say it's, we need more. I'll just leave it there. But we do have, I think Derek just showed the resources page, which has a few links to places where you can learn more about cannabis. And a couple of those are, in particular, that International Academy of Science and the Impact of Cannabis is doctors that are putting together research around cannabis. So there's a couple of folks, a lot of great places where people are kind of compiling data and sharing information.
Thanks everyone. I see the comments. I've heard of SAM and I used to really follow them, but I just don't, I don't see any, I don't know, I'm looking at like a need for a more aggressive, or at least a more, I don't know, aggressive is what maybe the wrong word, but a more consistent message that's like getting out there for parents, for youth, for
all the people I saw all day today, people were posting or a bunch of great resources. So yeah, if you go back through the chat and click on them, there's a lot of great ones. And then there's a few in here in this slide deck as well. And I will share, if it's okay, and I know we're at the end of time, but Derek, if we can go back to that other side, I made a policy toolkit for my state. You can see it here on the screen. And it is focused on Vermont, but that's just one section of like, here's the laws in Vermont, and the rest of it, please do feel free to use. There's a link to it in this slide deck, as well as I think in the handout you'll receive from today. And it includes 2 like template slide decks. So if you are someone who like, there's opportunities where you want to present to your community or to parents, you can take those slide decks and make them your own and change them however you want. So while you can't change this slide deck that we did today, you can take those. Those are for you to use. They were made to be generic slide decks for you to use and do with what you'd like.
Well, thank you again, Mariah, for sharing with us today. As we close today's workshop, I want to remind everyone of the power we have to shape the future in the wake of the cannabis legalization. And the strategies we've discussed aren't just policies, they're pathways to protect our communities, especially our youth. So let's commit to using the knowledge gained here and put it into action. Let's create the change that we want to see and build a healthier, safer future. This isn't just about navigating challenges, it's about leading the way. So thank you for your dedication to this important work and for being a part of the solution. Together, we can make a difference. And with that said, I wish each and every one of you the strength that you will need in order to battle this ongoing wave of cannabis as it rushes across our great United States, and put in the work to make your communities better. Thank you for coming today. You will receive these this slide deck and your certificate via email.